Thank you, everybody, for attending. It's been quite a while since we've had our last press conference, but as a city, we had committed to holding them once again when the need has arisen. I think we're here given the increase of cases both provincially and locally. But before I get into my COVID-19 update, I wanted to give a very brief update regarding our recent snow event, which we're also aware of right now. So I wanted to provide an update just on 3 points with this one. Obviously, our municipal works, police, and fire have been working tirelessly over the past 36 hours to keep our roads safe. There's more to come on this. Obviously, they are still working, and they're going to be working throughout the day, and obviously throughout the night here and in the coming days. Quite a bit of snow fell, and recognizing that there's quite a bit of work to be completed still. Working to get our transit service back up this morning. It has been delayed. However, we're anticipating a bit of a start here in the near future. And third point here is, and I think most of us are aware of this, we did have a power outage this morning that affected roughly about 883 customers throughout the city. It's interesting when we have a power outage in the winter, and we're always cognizant of this, recognizing that when we don't have power, our residents also don't have a furnace to run as well. And so in any type of situation where we do have power outages in the winter, we put our emergency social services team on standby. And just this morning, we were prepared to open up what are called warming centers for these individuals, but recognizing as well that our electric crews work tirelessly as well. We're able to get that power restored, and therefore our emergency social services team was stood down, recognizing that the need for warming centers were not required. And so just we are cognizant of power outages during the winter, and we do have protocols to ensure the safety of the public, recognizing that they don't have heat. But luckily, like I said, that power was restored. So going back into just the standard COVID-19 update, like I said, it's been a number of months since we've held one of these, and as a local authority in this municipality, one of our primary responsibilities throughout this entire event was to assist Alberta Health Services and Alberta Health with that messaging. And so now is the time where we need to increase that messaging and support Alberta Health Services wherever we can. Provincially and locally, we have been increasing in cases, and in fact, it's been doubling roughly every week to 2 weeks here. And just over the weekend, we were seeing provincially between 750 and 1,000 active cases per day come through. And Dr. Hinshaw said this, and I don't need to repeat it, but I will. It is a concerning number, recognizing that reproductive rate is increasing throughout the province. And like I said, locally, we're not in any exception by any means for this. The provincial website, which is there's a little section on there which is called the interactive data application, which shows the active cases locally, and we've been sitting stagnant on this at 15 cases. And the reason for this is because that provincial website has been down for roughly about 5 or 6 days now. And I suspect once that website is repaired, that our case counts and active case counts will rise. And this is important for one primary reason, and this is what was mentioned on Friday, and this is one of the main messages that I wanted to try to get across this morning for all of our residents that could be potentially watching this later this afternoon. Is some new restrictions were put in place on Friday through the province, and this is when any province, or sorry, any municipality reaches what's known as a watch status. And this can get a little bit confusing as it relates to do we know if we're in a watch status or do we not know if we're in a watch status. And so when we would reach a watch status, this is when we have more than 50 active cases per 100,000 people. And so when we look at it municipally and in our own city, we roughly sit around 40 to 45 active cases, and we would hit the watch status. So the question is now is what happens when we hit a watch status? So there are mandatory restrictions that get put in place, and this isn't the city that's putting these in place. This is the province that put these in place. So when a municipality hits the watch status, there are mandatory restrictions on social gatherings, and that's 15 people for social gathering. And the question is now, what exactly is a social gathering? And as per the provincial website, it's anything that is social related or mingling or conversational. So it'd be anything from, wedding receptions and funeral receptions for that matter. But I think the most important thing that we're seeing right now, and the most concerning thing that we're seeing right now is not so much the social gatherings where we're seeing those in wedding receptions or like it's in people's homes. It's where it's behind those closed doors. And so this is where we need to get better, and we're no different here locally. We need to get better at this and limit those social gatherings. And the reason why we wanted to come on and start these press conferences up is recognizing that the weather is turning, it's getting colder, we're getting into holiday season. And so if we do not change our behavior locally, is these cases will increase more so. And like I said at the beginning here, is it can get confusing as to, okay, do we know if we're in a watch status or do we not? And I think all of us can I guess, get better and improve within this process without recognizing a watch status or not, by just limiting our social gatherings and limiting how many people we interact with on a regular basis, because it's not happening at major shopping centers. Our case counts aren't increasing based on people going to restaurants. Our case counts are not increasing on places and businesses that have really good controls in place. It's in those social gathering areas. And so I do very much applaud all of those businesses that have been putting in these controls and actively using these controls, because they are working and the data shows it. And I've said this many times again, is I'm by no means a health expert within this process, but these controls do work. We just need to use these controls. And I'm not saying using these controls and based on those very specific guidelines within our home, but those simple controls is limiting the people that you're interacting with or without a watch status or these mandatory restrictions. Within our own organization, for that matter, is we've put our own controls in place that are mimicking these watch status requirements, so that we don't have this confusion as to, okay, are we in a watch status or are we not? Is we're just being proactive within this process. And I'm asking everybody and all of our residents to start being proactive and start putting these measures in without having a watch status or without these mandatory restrictions in place. It can be difficult, and I know as just a resident as myself, and getting the same information that the public gets from the provinces, it will get confusing when we flip in and out of these watch statuses and have these additional restrictions put in forth and then taken out without our knowledge. So I think all of us can just put these basic controls in place before we even hit this status. And I think that the key takeaway from this one is we could be very close to hitting that mark on the watch status. And so it could be this afternoon, it could be tomorrow, it could be the next day. And so recognizing that the interactive data app has been down, but knowing or suspecting that our case counts are increasing, we could be in for a bit of I guess a shock over the next day or 2 days or 3 days as to what our active cases are. Also knowing as to what's been occurring across the province with these cases. And so we're not immune in kind of our area of the province, recognizing that we have had a lower case count, but we are increasing. And so I want to have that message out to the community that we're getting there and we're getting up in cases, and it could be a very high likelihood that we will hit that watch status, no different than the majority of the other southern Alberta municipalities have hit. And so key takeaway from this one is limit those social gatherings. So that's a new one for me, in which I hadn't necessarily mentioned before. I always stick to the hand washing and stay home when you're sick, but this is a new one. And this is where our cases are coming from, is those social gatherings. So limit those social gatherings, stop having them all together if you need to. Limit yourself to those small cohorts. And so all of these measures, in addition to the social gatherings and limiting, do work. And I still have very much respect for our community here, and the fact that I know we can do this. We have done it over the 6 months. I know things are getting tiring, and but we can get through this, and we will get through this together. So thank you very much. I wanted to just mention that, recognizing that we could be very quickly approaching this watch status, and we can pull ourselves out of it and stay out of it if we just practice those basic things, such as limiting the social gatherings. Thank you very much.
Merrick, we've traditionally throughout this pandemic seen relatively low case counts in Medicine Hat as compared to similar centers, Lethbridge, Red Deer, and that. Are there any concerns that we, could be up into a massive spike rather than just a small increase?
Well, that's a great question. And so we have seen an increase in cases here throughout the city and throughout our neighboring municipalities, for that matter. And so I don't want to say that we're in for a massive spike, but given the fact that we are increasing, and we've had a number of businesses that have been reporting cases, is this virus does reproduce, and the transmissibility of it is very, very high. And so we could be increasing. I don't want to say that we're in for a massive spike, but recognizing what's been occurring across the province. And so just other regions that had a high case count, but then it decreased, are now starting to increase once again. And once it increases, and once those numbers rise, is they continue to rise exponentially unless something is done, and this is all up to us, is limiting those gatherings. This thing is not going to go away on its own. It's all up to us to be able to decrease the numbers and put this thing at bay. As much as the businesses are doing a great job, that's not where the case counts are coming from. And these active cases, it is coming from those social gatherings, households, parties, all of those matters. And I get a lot of questions on, mandatory face covering or mandatory mask bylaw. And this is one point where that mask bylaw will not impact it, because the mask bylaw does not impact somebody in their household. So if you're having parties in a household, the mask bylaw doesn't do anything.
Even aside from a mask bylaw, with an anticipated jump in cases that we might see once locally here the system gets rebooted, is there any measures from the municipal level, any additional measures other than asking people to limit social gatherings that the city is looking at right now to possibly curb the numbers spiking even more?
Yeah, great question, Scott. We're constantly looking at other measures. I mean, we're cognizant of a mask bylaw on this one. One thing that I've always been an advocate of is putting in controls to solve a specific problem. And this is one where once we identify what the problem is, we can look at some of these other measures. But I do want to go back, though, that I'm seeing an increased, action from Alberta Health Services. One thing that is, very much welcomed. And so we're still hoping and anticipating that if these numbers do increase, there will be some greater wide sweeping actions put out from Alberta Health Services. Not that we want that per se, meaning more restrictions, but we're seeing increased effort from Alberta Health Services on this one to curb this one, because the numbers are increasing. So when it comes down to municipally, are we going to put in some additional actions? Is we would anticipate that Alberta Health Services or Alberta Health would put those in place provincially or region specific, as we're seeing with what's occurring with the watch status. No different than what happened in Calgary and Edmonton, where they're just recommending no social gatherings whatsoever.
With the increase, I mean, are you as a municipality looking at possibly, limiting some or further limiting like the Family Leisure Center or the Viner Center, which was supposed to open up today on a limited basis?
Yeah, that's a great question. And so we have, recognizing that the social gatherings is based on those conversational gatherings, is we would need to, I guess, conform or comply with those social gathering requirements. And so whether that be that 15 person gathering, is we would need to comply with that. But that doesn't necessarily apply to, say, like a fitness facility or a pool that is very much based on those social gatherings. But our plans do, or especially I know the Viner Center plan does include specifics to those social gatherings.
I guess along that same line, has the city been planning or have any preparations if the cases do spike to an amount where another shutdown of facilities would have to occur? Has that been a process for the city preparing for possibly needing to shut down or limit capacity at some of those facilities?
Yeah, that's a great question, Scott. And so that is included within our plans. We don't specifically have case trigger numbers or active case trigger numbers. If that should occur, it is much more risk-based, recognizing what's occurring across the community. And I'll give you a good example here. And this is where we didn't, when you start looking at, say, like a mandatory mask bylaw, and I know a number of municipalities have this, I guess, threshold or criteria in place, is when you hit a specific active case count, is their mandatory mask bylaw would go in place. However, if we have an outbreak at one facility within the city, and I'm not saying a specific city facility, but it could be a city facility that hits that threshold, that active case count, is that would not necessarily necessitate or require a total shutdown of all facilities, we'll say, or limiting all facilities. We'd take very much a risk-based approach. What is occurring throughout the community? Obviously, the liaison with our Alberta Health Services representative as to what the appropriate measure is on that. And another thing is when you do hit a watch status, there is that communication that starts up, that increased communication that starts up with Alberta Health Services, recognizing what is the I guess, driver for the active case counts. And then as a municipality, and speaking with Alberta Health Services on that one, is what are some additional measures that can be put in place. And so when we do hit a watch status, my position is contacted through Alberta Health Services or by Alberta Health Services, and that communication starts up in a more formal manner as to what we can do between Alberta Health Services and the municipality to curb the increase.
Just going back to the limiting of social gatherings, pardon me, is, I mean, we've all seen and heard of, especially youth, and the trend towards younger demographics contracting COVID through these social gatherings. Is your message to them that much stronger to limit these gatherings?
Absolutely, Warren. We're across the province, we're seeing an increased number of, I guess, the lower age group social gatherings. I think Alberta Health Services recognizes that, hence the letter that was issued last week regarding Halloween gatherings throughout the southern part of the province. There is this, even though the under 20 or under 30 age group, you may not be impacted by it based on any pre-existing conditions that could put somebody into an intensive care unit or a hospital, is you can still pass this on to somebody, and it's still an active case, and it still is transmissible based on that point and communicable from that point. And so even though it doesn't affect you and it doesn't put you in the hospital, it could put somebody else in the hospital. We only have so many ICU beds in the province.
Yeah, just for people, maybe some older people too, where can they stay up to date? Is the city going to be releasing information, or should people follow Alberta Health to see if Medicine Hat is impacted?
Yeah, that's a great question, Mo, and that's one conversation that we need to have internally on this one, is because this is my I guess my concern or my message is we could flip in and out of this watch status very quickly. And one of the best ways to go to it is the Alberta Health Services website, or Alberta Health's website, to learn if we're in a watch status, and that can get confusing. And so my general message and overarching message is just to stop having these social gatherings and limiting your social gatherings. But at this point, the information would be listed on the provincial website. But again, we can have some internal conversation as to how this looks. We have not yet had that, recognizing that this communication just came out on late Friday afternoon regarding the additional measures.